Hi everyone, welcome to our new viral world. I'm Dr. Robinson. I'm an infectious disease specialist, and today I'm going to talk about how we can best optimize our use of masks and face coverings during COVID-19. Respiratory infections can be transmitted through the air in virus-containing particles, and these particles are categorized based on their size. So larger particles, or those greater than 5 micrometers, are termed droplets, whereas smaller particles, or those less than 5 micrometers in size, are termed aerosols. So whenever anyone is breathing, speaking, and of course coughing or sneezing, we're emitting these particles into the air. And these particles are then susceptible to the elements. So gravity, wind currents, and evaporation all affect how far and how long these viral particles exist in the air. The larger droplets, so those greater than 5 micrometers, often are very susceptible to gravity, and they'll fall out of the air more quickly before they can evaporate. And they can land on different surfaces with viable virus within these droplets. However, the smaller particles, or aerosols, that are less than 5 micrometers are less susceptible to gravity, and therefore they are able to travel farther distances. There has been some discussion about whether or not SARS-CoV-2 can generate aerosols. And given that, we should really think about the 6 feet rule as a minimum and try to stay even farther away from others in public if possible. There are multiple different types of masks that are used to help filter the air we breathe. N95 masks got their name because they're able to filter 95% of the airborne particles. These are tight-fitting masks that are often used in healthcare settings that can filter both droplets and aerosols. However, they are in short supply. Surgical masks can also be used in healthcare settings. They're more loose-fitting, and they are less protective against aerosols. And lastly, there are cloth masks. I'm going to focus on the efficacy of these types of masks today. I know many of you are using them now, and they're recommended for use for the general population. There are multiple benefits for wearing cloth masks or face coverings for ourselves, the environment, and the world at large. Cloth masks are usually made out of biodegradable materials such as cotton, and this allows us to wash and reuse them, which has the added benefit of reducing some of the adverse environmental effects of using one-use throwaway masks. In addition, it takes us out of the supply and demand equation for N95 and surgical masks, which are critically needed for our frontline workers. The World Health Organization recently estimated that we need nearly 90 million masks a month just for healthcare workers on the front lines to protect them from COVID-19. So wearing a cloth mask really has additive and synergistic benefits. So if you've ever been wondering, how well do these cloth masks really work? A recent article was submitted to medRxiv that wanted to try to answer that question in an interesting and creative way. So they took fluorescent beads that were the same size as a SARS-CoV-2 viral particle and suspended them in distilled water. They then took the suspension and put it into an inhaler similar to those used by people with asthma, and evaluated how well different fabrics were able to filter these fluorescent beads. So you can see here on your left-hand side the experimental setup. The inhaler here is in place, and then the fabric that they're testing, and then they're able to evaluate the number of particles that are filtered after impact. Using the medical or surgical mask as their control, they then tested several other different fabrics, including t-shirt fabric. And as you can see, that while one layer of a t-shirt fabric did not appear to filter fluorescent beads at a similar percentage to the surgical mask, adding a second layer had similar results to the medical mask, filtering over 90% of the fluorescent beads. And these results show that at least in an experimental environment, that at least 2 layers of a t-shirt-like material can potentially filter particles similar in size to that of the SARS-CoV-2 viral particle. A more real-world example of the importance of face coverings is a case study coming out of Springfield, Missouri, related to hair salons. So during this time, Springfield, Missouri had an ordinance in place for both the hairstylists and the clients to wear some form of face covering. The first hairstylist, we'll call hairstylist X, began to develop symptoms on day 0. She was concerned that these symptoms may be related to COVID-19, and so she went and got tested. That test came back positive 8 days after her symptoms started, and she stopped working. In addition, hairstylist Y, who had been exposed to hairstylist X, began to develop symptoms 3 days after hairstylist X. She then was also tested for COVID-19 and was also positive. So in combination, there were 2 hairstylists who were positive for COVID-19 that saw 139 clients during the time that they were symptomatic. Through contact tracing, they were able to identify the 139 clients who had seen these 2 hairstylists. None of them reported any symptoms related to COVID-19. And around 50% of them were willing to get a COVID test, were willing to be tested, and none of them were positive. I think this is a really incredible story about how well these face coverings work, because these were symptomatic people. They were in close contact with a large number of clients, yet to our knowledge, none of them contracted COVID-19. I know many places are still open and others have shut down again, but wherever you are, wearing a face covering can really be critical to preventing outbreaks during this time. Now that we've discussed how well face coverings work and the importance of wearing them, I wanted to briefly go over how to put them on and take them off, or donning and doffing. One of the first steps that I think is often missed is that we should make sure to wash our hands before handling our mask. So with either soap and water or hand sanitizer, remember to have clean hands before touching your mask. The next step is to make sure that the mask is covering both your nose and your mouth. So remember, when we're testing for COVID-19, we're often taking a swab in the back of your nose. So don't forget that this is an important area to protect. Next, check to make sure your mask is fitting snugly around the sides of your face and there are no large gaps. And lastly, make sure that you're able to breathe with the mask on and that it feels comfortable. Because once you're in public, it's better to leave your mask on instead of taking it on and off. So I often find that removing PPE or masks is a little bit more complicated than putting everything on. But just remember, if you have a mask that ties, to remove the mask from those ties, or if you have a mask with loops, to remove the loops around your ears, and to only handle the mask by those ties or loops. You can then fold the mask together and place the mask into the washing machine. And be careful not to touch your eyes, your nose, or your mouth during this time, and to wash your hands afterwards. And lastly, I wanted to go through how to best clean our masks. Once your mask is in the washing machine, set it to its warmest water setting. And if you're going to place your mask then in the dryer, set your dryer to its highest heat setting, or if you're going to air dry your mask, put it into direct sunlight. But either way, ensure that your mask is completely dry before you reuse it. Thank you all for taking the time to listen today, and subscribe below if you're interested in hearing more COVID-19 tips. My next episode will be discussing how we can clean surfaces in our home to prevent contact transmission. And I hope you're all doing well and staying safe.